Welcome to this episode of the Catalyst Podcast, where you meet Meg McElroy, who is a PA introduced to functional integrative medicine as a child. She started her functional medicine journey as a patient, struggling with constipation, acne, and menstrual challenges. But as an adult, she uses functional medicine to navigate the challenges of living with two autoimmune conditions. The peak of her autoimmune symptoms occurred in 2021 when she was experiencing compassion fatigue from working with complex chronic patients. Over the last 2 years, she's managed to keep her thyroid autoimmune condition in remission by implementing more boundaries and prioritizing daily time for self care and creativity. She holds a bachelor's degree in biology and religious studies from Colorado College, a master's degree in physician assistant studies from Philadelphia University, which is now Jefferson University, and she is board certified by the NCCPA and became certified as an IFM practitioner in 2019. She has an additional training in integrative medicine through 15 other organizations. So you might know Meg from her extensive resource, an ebook that she pulls together every few years and updates with all the different functional medicine training opportunities. And she really has done a great job researching them. We're going to talk about this ebook resource in this episode, but you're also going to hear her personal tips on how to choose the right training program for you. We'll also talk about ways that we self sabotage in functional medicine as a practitioner and how we actually contribute to our own burnout and steps that you can take to pedal back into sovereignty in your own power and make functional medicine fun again. Meg is great, sharp, witty, and really detailed when it comes to research. So she enjoys writing these blog articles and shares her knowledge with all the clinicians that subscribe to her efforts. So listen to this episode. I guarantee you are going to find some gems that might help you make things a little more efficient, practical, and fun in your functional medicine journey. Oh my goodness. I am so thrilled to have you here, Meg McElroy, because I know this is going to be such a powerful conversation. It's not often that I have been, wanting to talk with you for years because, we've kind of been in the same sphere and then just watching each other speak more about healthcare, functional medicine, exploring those edges, and then healthcare as a whole and the system and burnout and overwhelm. And so, like, all of this is going to be packed in this conversation. So, welcome to the Catalyst Podcast, Meg McElroy.
Thank you. It's pleased. I'm pleased to speak with you.
Yes, yes. I would love to start with your catalyst moment. Like, we all are, you know, part of these little teeny events that have such immense impact. They really kind of invite us to dig deeper or to show up in a different space. So, what would you say is a big catalyst moment for you that stands out?
Yeah, I was thinking on this actually the other day as I was walking my dog, and I was admiring all the beautiful colors of fall because right now this is the week of just red and orange and yellow leaves. And I was thinking about what got me into my current career and catalyst moments because I think there's multiple. And for me, it started in childhood because I had a lot of health issues and I missed a lot of school. My mom ended up finding an integrative physician locally who introduced me to how food could impact my health. And so I became really interested in herbs and nutrition, before I was basically 10. And so then I actually, did a lot of reading on it, but then if I hadn't had those health issues in childhood, I probably wouldn't be where I am, but I would probably be doing something like being a detective or helping animals. I wanted to be a marine biologist at one point or work with chimpanzees. And so I'd probably be doing that in some way because I've always been drawn to helping. But then, throughout my school and even college, I was really alone in pursuing, my passions for integrative medicine, nutrition, and then I basically, went to a whole talk by Jeffrey Bland in the early 2000s. And I think I was barely 20 at that point, maybe in my teens. And it was all about hops. And I just sat there in just amazement. And I was so like excited that there was somebody like this, on the cutting edge. And, it was way over my head at the time. But I left thinking, I want to do the same thing and I want to be involved in like the groundbreaking research and helping people and not just having it in research, but crossing it into like, helping people in the real world. And so then I ended up, kind of fast forwarding into my 30s. I attended an IFM conference and I didn't feel alone anymore because I was surrounded by people who were so excited about the topic. And then I realized there wasn't really any way to, kind of stay in connection with those people. So I figured it out and I made a Facebook group for other people who might be lonesome and lonely in the integrative space and just even just interested. And so I have a Facebook group now that has over 3,500 PAs and nurse practitioners or, similar fields that I vet out because I did have some trolls in the beginning. So I have people sign up with their NPI and then, that just continues to grow. And so then now after being a functional medicine practitioner for over a decade, I've realized that weekly I have these micro catalyst moments with my patients and they introduce me to things that I maybe wasn't aware of. But then I also realized that as my knowledge continues to increase, that I shouldn't be expected to remember it all. And so now at this point, my functional medicine practice is constantly shifting as a result of working with patients, which a good portion of my patients I work with through insurance, which is a whole other, let's just say way to approach functional medicine. And it's not as easy, I'd say, as doing it cash based. But at this point, I'd say I practice more methodical medicine rather than the functional medicine I was taught through the 15 or so organizations that I've now trained through. Mhm.
Yeah, this is great. Oh my gosh, you mentioned so many good gems in there. First, the community aspect of it. So much is built from community and realizing you're not alone and having your ability to be self-expressive in the kind of medicine you want to practice and deliver, whether it's pulling from functional medicine or other holistic lifestyle medicine practices. It's all a blend for each practitioner to
Mhm.
deliver what they want. And finding that community is crucial. And like you mentioned, there's many training organizations, and we'll go through some of that in a moment. But you also really centered on a key thing, which is functional medicine is only as efficient or I guess efficient's not a word, is only as impactful as the practitioner can be, efficiently and actionable in helping the patient understand. And so I'm curious with your experience in a insurance and in cash pay models, they're vastly different. We talk about this a lot in other podcast episodes as well as inside my Catalyst mentorship. There's practitioners that are doing hybrid practices that are seeing that it's possible to deliver functional medicine, but we have to do it a little differently. So, talk to me
Mhm.
more about your idea of methodical functional medicine.
Yeah, so when I first got started in functional medicine, I was a part of practice where I'd say it was like test and treat everything. So people would leave with, 3 to 5 tests to do and maybe 10 supplements to take without having any data yet. And it works for some, not for everybody. And then methodical is more where you start with one thing at a time, even, one supplement at a time. If you're recommending multiple at once, that you start with one, make sure somebody tolerates it. Because I definitely work with super sensitive patients
Mhm.
that can't often tolerate certain supplements, even powders and liquids. So you really have to get creative with patients. I mean, it is really hard when you have this idea of how you want to treat, but then you end up finding out that they can't swallow pills or they want to prioritize food over
Mhm.
supplements or pills. And then you do have to get really just kind of interested in why that is. And then, and take extra time, to look into those ways to treat. But with, kind of that all or, kind of all in, that's the approach that a lot of like, I don't want to say
Mhm.
celebrity, but, let's
Mhm.
just say well known practitioners use in the functional medicine space, but it kind of gives it a sensationalist
Yep.
kind of stereotype that functional medicine is going to cost thousands of dollars
Mhm.
and use lots of supplements, but it's not really, if you really look at the PubMed articles that Jeffrey Bland wrote, for example, he actually talks about how it's not all about a bunch of supplements. It's really understanding the biology and pathophysiology and keeping that in mind all the time when you're
Yeah.
working with a patient. And so
Yeah.
now at this point, because of the insurance model, that we're trying to do in California and New York with my current practice, but then also having some cash pay patients or we basically have to start one thing at a time, and membership models are key for that, right? I think
Mhm.
you have a membership model
Mhm.
even, and
Mhm.
fee for service, it's just not going to get the results. And then when you have a membership model, you can track like how people are improving, because that was one thing I realized in that all do it all at once kind of model. There wasn't really any way to track who was following up, who was getting better, and what was making them better. Because I always like to try to find out, was this a game changer for you, this treatment I recommended, or or was this something that maybe augmented or improved your life, but maybe wasn't a game changer. And because I asked that question of pretty much everybody, I'd say at this point only about 20% of people say it was the supplements that got them better. More often
Yes.
than not, it's like the education that gets.
Right.
Mhm.
Oh my gosh. Yeah, you're hitting it all. Right. Absolutely. And I think your word of methodical is really a wonderful way of just saying good medicine, honestly. And I call it practical Midwest medicine. I've always
Yeah.
said that, this is the almost culture shock that I felt as a conventionally trained family medicine physician that exited and went into functional medicine full time. The culture shock was seeing that a lot of people at the time were running these almost direct to consumer practices where it was like, okay, just order all these tests and here's your laundry basket of supplements. And I was like, wait, but that doesn't feel like it's personalized. It doesn't feel
Mhm.
like it is even attainable in my community, which is a very rural community. Not to mention, like you just said, change is hard. And just even though we might know that they would have all these different habits would serve them better, or if they did these
Mhm.
things, it's so hard to inspire that change because it's not us, it's the patient that needs to be driving the car. And so
Yes.
that takes time, and membership is the only way to do that because they're able to go at their own pace and they're able to try things one by one, order the tests that are needed, not
Mhm.
everything under the sun. And I think that is the disservice that the wider education of functional medicine has done to our global
Mhm.
community is patients think that it's going to require all these expensive things, and like you said, it doesn't have to
Mhm.
be that way. It could
Mhm.
be simple little steps that you create that relationship with your provider, who gets to know your goals and your habit changes. So in cash pay, membership works really well for that. So in an insurance model, what are some challenges that you see that you've corrected or learned how to be a little slightly different in the way you cultivate a functional medicine mindset?
Yeah. So by working with patients through an insurance model, I've had to realize that, good probably 75% of people won't pay for things if it's not covered by their insurance. And so I have to get creative and focus on food and teas, or, even, herbs and spices, and give maybe one recipe at a time recommendation. Granted, in my practice, I work with health coaches so they can expand on that. But I have to give really granular guidance, and then follow up a lot more frequently than maybe every like 6 to 8 weeks that we might be doing with the cash pay patients, or we call them members in my current in the current practice I work with. And so but it also kind of gets me frustrated because if I recommend a supplement and I really advise them to go with a third party professional grade
Mhm.
supplements. A lot of times, they kind of balk at the prices and say, oh no, I'll just go buy it off of Amazon. And then they don't get better. And
Mhm.
then, or they even feel worse because of all the extra
Mhm.
stuff in the supplements. And so it does get really, I have to, kind of give them grace and realize that they've been indoctrinated into a system that is, insurance should pay for everything health and medical related. And that taking, charge of your health does require an investment, but it doesn't need to be the investment that a lot of people associate with a functional medicine model. And then a lot of the people that I work with on insurance aren't even aware of what functional medicine is. They just heard
Right.
about it and they thought, oh, I'm going to try it out. So, mhm.
Right, right. And, I love how, you've made this in a fashion with the experience you've had in both insurance and cash pay to, again, let the patient sort of explore at their own pace. And I think that's critical. We all get so passionate about functional medicine because we love teaching about it, but it can overwhelm our patients. And I feel like that is really where the rubber hits the road in making this accessible to people is keeping ourselves in check and really making sure that we're educating at their pace, at what do they need to know. And I think that's where functional medicine can lend into burnout, is if we're over serving, trying to over educate, trying to lay out every single facet of why they might be unhealthy. I mean,
Mhm.
oh my, that would be very overwhelming to the average patient. And so really, it's not the more credentials we have that makes us a better clinician. It's actually how can we meet them where they're at and deliver functional medicine in a way that doesn't cause burnout for us, because it can feel like we are trying too hard when, in fact, if we just took a step back into our own power and let the patient lead, functional medicine is a beautiful opportunity to have a relationship with your patient. So I'm curious, this kind of leads me into the questions. You've been one of the go-to resources for new people to functional medicine, saying, there's so many options out here for training. Speaking of credentials, right? Many of us fall into that self-sabotage of, I just need more credentials and then maybe my patients will get better, when, maybe not, that's not the case, but you do want to fit the training institution to what serves you the best. So you've become this go-to resource. Why don't you talk to me about that journey?
Yeah, yeah. So I actually, my journey started with looking at PubMed articles and that Jeffrey Bland conference I went to or workshop, and then when I started with IFM, I was loving all the information, but I wasn't able to really apply it in a conventional medicine setting at the time. And so then I started thinking, well, what else is out there? And I joined Facebook groups, and people would mention, an organization, and I would look it up and get all the details and put it in kind of a document and get, find out pricing and, how much they, because I'm a nerd, so I want to see what the studies are that they're using. So I'd want to know how much research do they provide so that I can take a deeper dive into it. And then realize that there were a lot more than just the handful of organizations that most people are aware of. And that, we're always going to be lifelong learners when we get into functional medicine. I mean, curiosity is what brought us into functional medicine. And, I mean, at this point, I think I've done maybe 15 or maybe even up to 18 organizations, the training, but I'm constantly wanting to learn, but not necessarily at this point, the content. It's,
Mhm.
the art of applying it. And that is, I'd say that's where the results happen, is in the art of application. And so when I gathered this resource, or all these resources, I thought, well, let's put it into an ebook, because I would get questions with people saying, through social media, can I pick your brain? How did you get started? Which one should I do? And
Yeah.
so then I realized there's not any best program out there, but there
Mhm.
is a better, like a best one for somebody's learning style. And so in the resource, I try to mention the difference between integrative and functional medicine, health coaching. I touch on it, but it's not intended for health coaches.
Mhm.
It's intended for clinicians with a medical background. And then I just keep adding to it. I think at this point, I re kind of up it every 2 years. I can do a new version, and then anybody who has the past versions, I just send it to them. But I'm due for kind of doing that at the end of this year, and there's probably 15 more organizations I'm going to be adding to it.
Oh
Um,
my gosh, that's exciting.
Mhm. Yeah, yeah. And so I even include business training because I get that
Mhm.
question all the time. For example, you're in there as well. And so, because that's a whole other, aspect of
Right.
medicine that, people often get into so they can be their own boss or be an entrepreneur.
Yep.
But you need guidance on it, because I did it for 2 years without the guidance. And that was one of my biggest,
Yeah.
do-overs. If I had to, I would get some training,
Yeah.
through a mentorship, where somebody is guiding me on what's
Mhm.
going to be best, fee for service or membership, brick and mortar versus virtual, those kind of things.
Mhm.
And so I actually remember encountering, do you remember Dr. Roundtree through
Oh my gosh,
NC?
of course, sticky
Yes,
buns. He always talks
yes.
about sticky buns.
Sticky
Yes.
buns. Yep. Yeah, and I ran into him at a talk actually last year, and I mentioned this resource. And he said, "Well, why? There's IFM. You don't need anything else." And it was really funny, because I realized that there are people who just think that IFM is the only one available, it's the gold standard. But there's about 5 or 6 comprehensive training
Mhm.
programs at this point, and I found 2 more I'm looking into. But SAFM, which I know
Mhm.
you're familiar with,
Mhm.
IFM, there's Kalish, there's
Mhm.
now Karasian, although I don't know if he really can be considered comprehensive functional
Mhm.
medicine, but he definitely is detailed. There's so many options, but then there's also individual courses. So if
Mhm.
somebody just wants to learn about thyroid or just
Yeah.
wants to learn about the gut, there are all these, other resources from seasoned practitioners that have either put them together or through
Yes.
organizations.
Do your patients have this glassy eyed look as you're trying to explain mast cell activation syndrome? Or perhaps you're running late again because you were trying to describe the physiologic impact that a dysregulated limbic system has. Listen, I get it. My years as a family medicine physician taught me that the sooner I could help my patient understand what's going on in their body, the quicker they felt better. And the same holds true in functional medicine. When I started my practice in 2016, I quickly learned that that's a big ask. Functional medicine is pretty complicated, so I went to work. I started designing infographics specifically for functional medicine. So it makes it easier to explain and help your patients understand what's going on. Fast forward, I have over 70 infographics in 4 themed bundles. And you get lifetime access as the editor. You get each Canva link so you can upload your own logo, you can change the translation, you can change the colors, and you get lifetime access, including any future infographics that are added. This is perfect for patient education handouts, for your waiting room posters, for social media, and even backdrops for lectures you can give to your community. So it's time to color outside the lines and catalyze deeper understanding in your practice. Head to drlarasalyer.com/shop and check out the infographics. Keep coloring outside the lines. I love that you're putting this resource together. And I mean, you've had it for years, and I referred so many people to that ebook because everybody, and I believe I even have a copy from years ago because I remember looking at it going, this is incredible. I mean, it really is. You did your work. You showed the notes. I mean, you went through and that's what I want everybody listening to hear. If you're new, you're a med student, resident, or whatever, a seasoned veteran practitioner, and you're like, I really do want to learn more about functional medicine. It is such a large world. There isn't
Mhm.
one best program. It is how do you learn best? Because we're adult learners, and sometimes we're fitting this on the edges of our life. You might have a family or a second job, and you're trying to do this at night or in between, on break, vacations, and so not one program is going to fit all your needs. And what you need to do is look at how do you learn best? What are your key, areas of functional medicine you're curious about? And then
Mhm.
I always joke you want to have one healthy BM a day, which is a bare minimum. So what program gives you the bare minimum, right? What
Mhm.
program gives you most of what you're looking for? Because as a veteran, I'm an IFM certified practitioner just like you, and I loved IFM. It was my first, kind of shallow end of the pool, and as I got deeper, I realized, okay, they're not everything either. They're great, but there's different opinions depending on which specialty organization. So I've taken classes with Karazian, with A4M, with, IMMH. There's so many other organizations that provide great information. And as a diehard family medicine physician, I can't know it all. Family physicians are good at the high altitude stuff, but when you really want to dive deep, you might need to go to a specialty organization to get the hormone education you're craving, or the mold education. And so I love that you've incorporated a lot of this great, like, just organized resource for people that are looking to explore. Because
Mhm.
like you said, it's not the content, it's not really the stuff inside, it's are you able to really apply this in your day? And we could spend all day every day for the rest of our lives learning from all of these organizations. And it's really comes down to what can you practically use in your day to day.
Yeah. Yeah. Because, for example, like Karazian, he takes a deep dive into the science and into the pathophysiology. And, we learn that through a medical training or conventional medical training, but it kind of goes, kind of on the back
Mhm,
burner, right? But
mhm.
in functional medicine, we have to kind of what do I say? Yeah, just kind of recall that in a practice, like when we're with a patient. And so, I mean, I have, definitely things up on my walls where it's like, here's a pathway I have to remember. But yeah, when it really comes down to, the training we choose, there's not going to be, it's not finite, right? We're always going to be learning. So you start with what resonates with you the most. And, I always say there's, when people reach out to me, I say, well, there's kind of three main tips
Mhm.
that I usually recommend. And definitely, one of them is, knowing why you're interested in functional medicine. And so if you start asking yourself questions about, is it a particular condition I want to really understand, or I want to, learn more about labs and supplements, or is it the lifestyle and nutrition aspect? There's so many things that then, as a resource like that can guide, because I do have lifestyle medicine options in there. But then I had to keep it an ebook so that I could have clickable links.
Mhm.
So that's been the trickiest thing with, when I kind of do a new version of it, is going through and clicking all the links to
Oh.
make sure that they're still active. So
Oh, bless your heart.
yeah.
That is hard. Technology is always, and even
Mhm.
when it's the same resource, it's like for some reason the URLs have to change by like a few letters. It seems
Just a
like
few
every
letters.
time. Yeah,
Mhm.
it's annoying. Oh, but thank you for all that work because
Mhm.
honestly, you are giving such a great, unbiased resource for people to look at. And that's the nice thing is they can count on like this is just yes, it's your opinion, but you've done the work at looking and updating because I know every organization always is changing. I mean,
Mhm.
as I am employed by SAFM as their director, their main mentor, as faculty, I see all the things they're doing differently. They have like their own ecosystem now that, serves from like cradle to grave where people learn and then get the business education. But like, who knows what's going to happen in 5 years? There'll probably be even more organizations. So you kind of have a forever job. You kind of are always going to be updating the rest of the world, which I think is awesome and a great service. Because, like you said, this is important. And as I've been so excited to learn from the greats like Karazian, he has his own brain has a zip code, I swear. And
Mhm.
some of these other amazing Dr. Jill Krista and all these other people that have really taken a foothold into their own expertise, the one question I sit with myself every lecture is I go, okay, how can I put this right to patient care? Like I
Yep.
know it's fun to learn all the geeky stuff, but I'm like you, I'm like practical. I'm like, okay, that's great to learn that pathophysiology, but my patients aren't going to care as much. What can I do? What is the take home thing I can do tomorrow? And that's really important. And some of the training you get is really just your own kind of patting on the back. It's really about how can you impact your next day, which leads to my next question. You've talked a little bit off air. We kind of talked a little bit about burnout. And I think burnout happens really often in functional medicine because we sort of take on the journey on our shoulders to help patients feel better. So, what is your take on burnout? Can you share some of your personal ideas?
Yeah. Yeah, so I actually have been through burnout, and because I worked for a practice where I was having to do, functional medicine 5 days a week, 9 to 5, and seeing, up to 12 patients a day that, and sometimes more, that really, you know, I mean, they were complex chronic patients that had seen Mayo Clinic and specialists and weren't any better. And then, you know, I've definitely done, classes on it and read books. And then I can't remember the name of the book right now, but what resonated with me is that we as practitioners in conventional or functional medicine, we can experience something called vicarious traumatization or almost vicarious PTSD
Mhm,
when we're working with a patient that has all these, concerns, and we're trying to fix them, but we often forget, to ask what's going right in their life. And
mhm,
so that is a key question that I ask now is, where are your health wins? What's going right? Because it's so easy for somebody to unload on us and
mhm,
say, these are all the things that are going wrong and I'm not any better, or whatever it may be. And or they don't think they are, right? But thankfully, when you can track, using something, we call it a PSI, but basically it's a symptom index to track between appointments. And that's why something like membership is so important, because you can
mhm,
see, has somebody improved by following that score. And so with burnout, I've had to modify how I treat patients through functional medicine, because I did start off, kind of just running everything because it was cash based. And then um, as I realized, like, I don't need to remember everything. And so for me to overcome burnout, I needed to be organized and have, tools that helped me kind of be a backup brain, so to say. And so I have an entire spreadsheet now that is just my one document of go to. So if I want to recall the mechanism of action of something like inositol, I have it in there, or want to recall, what other testing can I do for something like anxiety, or, anything that I just, I might be meeting with somebody who's already been through the gamut with another functional practice and has done a lot, but I want to make sure that I don't forget something. So I have it all as kind of a
Yes.
backup brain, and then I can exercise my creativity that way because, as you know, creativity is kind of the antidote to burnout.
Yes, ma'am. It
Mhm.
certainly is. I love that. You're right. And oh my gosh, so many great things you just said of using a peripheral brain. This is why I love digital AI revolution. I mean, I'm here for this. It's finally about time for us to use these wonderful apps. I use text expanders for the same reason that you have your spreadsheet is I put my knowledge into these little like chart parts that kind of travel with me wherever I go. And that way I can go, what was that list? Because you can't remember it all, and it eases my cognitive like stress of going, okay, it's there somewhere. I just have to find it. I know I'm not going to lose it. It's in this digital space. So one wonderful way for you to, lower that cognitive drain in your brain so that you save up those wonderful alpha brain waves for your creativity. That's huge. And when you're mentioning burnout, you were touching on the second part of burnout. So burnout is three things. It's depersonalization, meaning you don't feel that you're even in this mission. You can't see yourself in this career. Now, many of us, we don't have a problem with that. In functional medicine, you're living your passion. So you feel very personalized into this career. The second one is low perceived achievement, where you feel like you're not making a difference because your patient's not getting better. And that's the biggest slide into burnout in functional medicine is we attach too much to our value, whether the patient's getting better or not. And you have found really great ways and strategies to sidestep that by recalling faster and more frequently, okay, how are you feeling today? Because a lot of times we, like you said, center on the negative, like, oh, I'm not better, but
Yeah.
oh, wait, but my headaches went away, and there's so many little wins that we can help our patients see. And then the last part of burnout is emotional exhaustion, which you have done a great job saying, I'm not going to get exhausted with all the things I need to remember. I'm going to save it in a different way. And I love that. This is the power of group visits too, is it can help patients see that they're not alone and they share that knowledge together. They can cross communicate and go, oh, yeah, I struggled on that step as well. And oh, here were my tips. And so, that's another way. What other things do you do personally in your own life to help yourself with burnout?
Oh, yeah, that's a big one. I mean, I've discovered that I have to get outside at some point. Even if it's snowing, because I'm in Colorado, but even if it's snowing, I have to just get outside just to, there's something about the air, and especially in Colorado, right? That is
Yes.
just so clean and kind of almost, kind of washes over you and kind of almost resets. So I have to get outside, and then I stretching is actually a big one for me because
Oh,
being mostly virtual, having my head in the same position all day, I have to do stretches multiple times a day. And then something I've learned from the health coaches I work with is habit stacking. And I'm
yeah.
sure you're familiar with it, but
Love it.
doing things like if I know I'm not going to get a workout in, then while I'm brushing my teeth, I might do some squats, or while I'm waiting for, the hot water to boil, for tea or coffee, I'm going to do something. And so it's just fitting it in whenever I can. And then I've actually really gotten into to breath work lately.
Mm.
And it's something that, just taking deep breaths. I mean, when I work with patients where I can tell that stress, which is a huge root cause of, let's just face it, that's a huge root cause of so many health issues.
Mhm.
And breath work is just so easy and free. And so having an app that reminds me to take a deep breath, right? That
Right.
would just be so helpful, or post-it note, because I'm a post-it note fan. So I've got them all over my computer. So
I love this. I love this. I'm the same. I love post-it notes for that reason. But yes, breath work. And I know it sounds so simple and I think that's the hard part with us as practitioners showing up to this space, this container of a relationship with a patient is often the solutions are simple. And I think we feel like we have to prove ourselves in other ways because if we just tell patients to take a deep breath, they're going to look at us like, well, of course, but really that is medicinal and it helps both us on one side of the desk and the other or the computer screen. And I think practitioners listening, you know, we are such experts at what to tell other people to do, right? But looking at yourself and finding, like Meg was saying, is what lights you up? What helps you pedal back from the brink of burnout? How can you step into a space where you feel full? because as we go from room to room or Zoom to Zoom, are you releasing that energy from that last patient? Are you shaking it out? Are you taking a walk? Are you doing a wall sit? Are you jumping jacks or inverted poses to get the blood going again? And
Mhm.
then like refreshing your palate and going back into the next patient, because that energy can stay with you. And by the end of the day, like you said, your head's in the same place. You feel kind of stuck. I love that you are sort of cleansing your palate with different things. Oh, and you mentioned off air some writing. Are there any other creative activities that you like to do?
Oh yeah, I mean, so I grew up, I was an artist, and so I actually entered art contests, and that's how I got bikes and TVs and
That's awesome.
anything that was there was a prize, I was entering it. And I even had there's something called the Avery House in Fort Collins. There's an Avery House competition where you would do a drawing and they would put it on a postcard, and so people could buy it as like a card for the holidays or whatever it may be. And so I was an artist and I actually thought I was going to do medical illustration at one point.
Ooh.
And then now at this point, after realizing I need a creative outlet that, beyond what I can do, through getting outside or I have a mini trampoline I'll jump on or dancing, which I listen to my favorite music when I'm on the trampoline for 10 minutes at a time. And
Love
it's such a
it.
cheap, easy thing. But I actually am getting into writing and using my voice more because one thing that they don't touch on too much in functional medicine, it's more integrative medicine, is anybody with a thyroid issue, which I have a thyroid autoimmune issue, it's
Mhm.
near our voice box. And we need to exercise our voice in some way because I'm more visual. Historically, I've been more visual in my creative outlets, but to exercise my voice is going to help heal and kind of keep my thyroid in remission. And so I've been doing more writing and speaking to try to, get my voice heard because for the longest time I've just kind of suppressed it. Because, growing up again, everyone thought I was kind of odd. I was even bullied for my beliefs and my interests in avoiding antibiotics and eating, healthy foods. And, so I think that contributed to the development of autoimmunity. And I think it contributes to the development of autoimmunity in a lot of people. And as you know,
Mhm.
women are particularly affected by autoimmunity. And I think a lot of women, they suppress their voice. And so I do a lot of writing now. So I have blog articles that I do that are geared towards practitioners on my website, but then I've been doing a Clinical Pearls newsletter that I started this year, and it's almost weekly. Sometimes I'll just do it 3 times a month that I share kind of 3 tips. I take a deep dive into something from a functional approach, but because I'm a nerd, I always share some research that people can look into on PubMed. And then something that helps me stay organized is EMR templates. And so I share an example of an EMR template out of the thousands that I have that people can utilize in practice, if they feel comfortable, utilizing that and to start incorporating functional medicine into their practice with or without training.
No, I love this. Oh my goodness. That's awesome. I bet your throat chakra is very happy because, that energy of expressing your voice is a gift, not just for yourself, but for the rest of us that get to share in your passions. And so I just love that you spent time with me here, Meg. In closing, where can people find more of you, specifically the ebook of resources?
Yeah, my website's probably the easiest. It's www.megmcelroy.com, MEGMCELROY.com. There's links to social accounts there. I won't do much more than Instagram. That's where I'm more likely to post things. And again, I'm targeting. I say targeting, but I'm, you know, let's just say sharing my message to practitioners more so than patients. At one point, I thought I'd call myself a functional medicine liaison, but I on social, I'm functional medicine PA for Instagram, and then Facebook. I'm not super active in my personal accounts, but I've got the Facebook group for any PA or nurse practitioner or similar, profession. I've got all kinds of shades. Let's just say I've got midwives and then everyone in there. I don't admit doctors, unfortunately, right now because people want to feel like a safe space.
Yeah,
And
good.
initially, when I had the Facebook group, we had some trolls that did screenshots and said this is why PAs and NPs should not be practicing medicine. So, to keep it a safe space, I do vet everybody out, and I do
Good.
let
I honor
patients
that.
in.
Good.
So,
Good. That's
yeah, so
important.
those are kind of the two main. well, three main places to find me. And then the resources are on the website. And then I am, working towards doing a course that I started 6 years ago that I'm finally bringing it to life on getting started in functional medicine because so many people ask me about it pretty much weekly at this point through the social accounts and LinkedIn and such. So,
I'm so excited. I'm so glad that we got to finally share some space together. And yeah, no doubt, this is such a wonderfully expanding area. And your ability to talk about your experience and share tips and strategies and practical things is really going to help the collective, all of us that are practicing in this sphere. So thank you, Meg, for coming. In
yeah.
closing, if you were 8 years old, let's go back. What would you be doing on a free Saturday?
Probably puzzles, art, and gymnastics. Those are kind of my big interests at that age.
And that makes sense because you're kind of a detective now, putting puzzle pieces together
Yeah.
for patients and expressing yourself with creativity and art and writing. So, thank you again for coloring outside the lines with me today on the Catalyst podcast. And if you're listening, please share this episode with a colleague who might be interested in exploring more about functional medicine. We need more people that are Catalyst practitioners daring to embrace the innovation in healthcare and transform patient lives without burnout. Until next time, we'll have a great night and see you later.